Welcome to Counterpoint. I'm Tanya Granick-Allen. Since COVID started, millions of Canadians have or are currently receiving a government benefit called the Canadian Emergency Response Benefit, or CERB as it's commonly referred. At $2,000 per month, this money was supposed to help Canadians get by with the sudden loss of income imposed by countrywide lockdown. And it was supposed to be temporary. Well, fast forward 1 year, and not only are we still in lockdown in various parts of the country, but the CERB program is still ongoing. But was CERB an accidental experiment in basic income? And is there support for such a measure? Well, Trudeau's Liberals have shown strong support for this program. It was the top policy at the Liberal Policy Convention last November. But is this the right way forward for Canada? Can we afford a program like this? Can we not afford to do this? Is it something which a just society ought to embrace? Well, joining me now to help us understand the pros and the cons with the concept of a basic income program in Canada is Roderick, speaker, publisher, and author with his most recent work titled Basic Income, How a Canadian Movement Could Change the World, and Dr. Rhys Kesselman, Professor Emeritus with the School of Public Policy at Simon Fraser University and co-author of a recent BC government report exploring basic income, covering all the basics, reforms for a more just society. Welcome, gentlemen. Thank you so very much for joining me today.
Thank you. Nice to be here.
Thank you. And I think I'll start with you, Roderick. Obviously, this has been a passion project for you of some sort. You've written a book, a very exhaustive book on this topic. So perhaps for our viewers who may not be so familiar with basic income, could you just please explain what is basic income?
Yeah, as the Basic Income Canada Network defines it, it ensures everyone an income sufficient to meet their basic needs and live with dignity regardless of their work status.
Okay. And what compelled you to become an advocate for basic income?
I had been concerned for some time about income inequality. And the more I read about it, the more I wrote about it as a journalist. The idea of a basic income seemed to be a simple piece of the puzzle that we absolutely needed to have in a just society, to use your words. That's not to say we don't need social programs. I'm not a Milton Friedman sort of basic income advocate where we cut a check and leave people alone, but we absolutely need the agency that giving people money in our society would give to them in conjunction with social programs.
Okay, and Dr. Kesselman, you were part of a government panel to report on whether basic income was the right path forward or is the right path forward for those in British Columbia. In your report, you suggest that BI is not the most just policy. And we're speaking of this term justice and just. Could you please expand on that, please?
Sure. We obviously did a bit of analysis. We had 2.5 years. We commissioned 40 studies from people expert in subfields. Our conclusion was that certain forms of basic income were desirable, that is targeted at particular groups that are highly vulnerable. I can get into detail later. But that a general basic income of paid to everyone of working age was first of all, very, very expensive. And secondly, didn't use the funds effectively. And third, we felt that services, in-kind benefits, are essential for the vulnerable population, both maintaining what we have now in terms of healthcare and education and legal aid and so forth. But in many areas, they need to be expanded. And you can't do everything. The public's not going to support much higher taxes. I mean, that's our belief, and also looking at surveys of support for basic income. Once the interviewee is asked, would you pay more taxes for this? The percentage saying this is a great idea drops dramatically.
Okay, you brought up the fiscal perspective. So based on your research and in this report, I'm sure you suggested, how expensive would a basic income project be in British Columbia in the 30 seconds we have left before commercial?
Okay. If it were guaranteeing the poverty line about $20,000 for a single individual, and reduced at 30% of your earnings, it would be about $17 billion. In other words, about 1.5 times the total income tax collected by the province.
And that's just for
So
British Columbia.
It's big. Yeah.
Okay, we're looking forward to picking up this discussion right when we return from this commercial break. Please stick around. Welcome back once more. I'm joined by Dr. Kesselman and Roderick Benz, and we're discussing basic income and would we see something like this in Canada going forward in the next few months? Maybe I'll ask you, Roderick, this question. So there is a difference between basic income and universal basic income. So which do you advocate for? Which do you think is more necessary?
The basic income that we advocate for through the Basic Income Canada Network, and me personally, is the only one the public would have appetite for, and that's the negative income tax model, where if your income dropped below a certain threshold, then it's topped up. So everyone would have that foundation beneath them, so that they wouldn't slip into poverty. The UBI, and these terms are sometimes interchanged, is simply sending a check to literally everyone and then taxing it back. If you were a wealthy person and you didn't need it, then it would be taxed back.
Okay, I understand. And I think when we discuss the CERB, the CERB, that was a negative income benefit because, and I did find this somewhat strange that only if you made a certain amount of money the year before, then you received a CERB benefit. Well, what about those who made far less than that threshold, than that $5,000 the previous year? How would they not qualify? Roderick, did you find that strange, or maybe I'm just misinterpreting it?
No, the CERB, there's no doubt the CERB was hastily designed by the government's own admission. The idea was to get cash out the door. They did that swimmingly well, but perhaps a little too well. And it doesn't quite meet the threshold for a basic income, except for the fact that it did keep people above the poverty line. There's no doubt about that. But as a work incentive, finding that sweet spot to ensure that people are still thinking about work, that wasn't on due to the pandemic anyway.
Right. And Dr. Kesselman, I found it, I don't know if you'd say fortuitous, obviously it wasn't if we were all locked down in a pandemic, but it was timely that you were investigating and doing this report, then all of a sudden we were in the situation where there was some element of a basic income through this program called CERB kind of being rolled out suddenly and perhaps hastily, as Roderick said, in Canada. So how did that live, almost pilot project factor into your report?
Of course, we did have to think about that and comment on it. I think Roderick's saying, and I would agree, the CERB is not the ideal model if we did want to go for a large basic income, because it sent a lot of benefits to those who didn't need it and failed to send benefits to those who did. It's not responsive to variations in income within the year, which is kind of challenge and why the panel went for using the provincial income assistance system, which has monthly income reporting. Canada Revenue Agency gets information on individuals' earnings only on that T4 that you get in January or February. The employer otherwise reports just on aggregate amounts of taxes withheld from all of their employees on a monthly or quarterly basis. So, of course, income assistance has a lot of warts, and we try to deal with them in our recommendations. It's certainly got stigma. It's got miserly benefits, and a lot of issues. And we are recommending major reforms like getting rid of the asset test, getting rid of a 3-month search requirement that is needed in BC before getting benefits or before the application is processed. A variety of things.
I was going to ask
the
about.
world is messy.
Yeah, I was going to ask about the asset test. Can you please explain what that is? Does that mean if somebody has, like, say, a residence that's in their name, perhaps it was bequeathed to them, that then works against them if they have very little income, but yet they have this asset?
The way it has worked in BC, and I think probably most provinces, is there's a threshold. If you have more than X dollars in financial assets, you simply do not qualify for income assistance. It may exempt a family home if you own it, may exempt a car up to a certain limit, but otherwise it's an either or. If you're above the asset limit, you simply cannot get the monthly benefits. And we, looking at the data, we see that really was not very effective in that very few people. The benefit levels are so low in income assistance that it's kind of rare that people have assets well above the existing thresholds.
Yes, and I think it's interesting. We're going to talk about other benefits that exist and how a basic income might compare or duplicate them. But I know, for example, for those in disability, if they have an asset, sometimes that works against them when they're perhaps receiving disability benefits. We're going to continue on with this topic right when we return from this commercial break. And welcome back. We're continuing our discussion on basic income. Just before the break, Roderick, we were discussing the CERB benefit and whether it was a basic income pilot project, as some have suggested. But it sounds like it, as you mentioned, it was hastily implemented and it did not sort of achieve the same result that a basic income program that you would have liked to achieve, and it didn't target the right people. Am I correct?
No, that's exactly it. We had an Ontario pilot here in 3 communities, as you probably know, in Lindsay, where I live, in my hometown where I grew up, in Thunder Bay, and in Hamilton. And unfortunately, the Ford government killed it unceremoniously. One of the first things they did when they took office. But we did get a lot of statistics from that, even in the amount of time that it existed. And we put it in a report called Signpost to Success. We know that 58% of those in the Ontario pilot improved their housing situation. 34% found the basic income supported employment by affording transportation to work or childcare and so on. And in the baseline survey, 11% of participants volunteered in the community. And in our survey, 25% did. Oh. So when we take the worry of poverty away from people's shoulders, we see how much community good can come from a basic income as well. And one of the issues I have with the BC panel and the recommendations is if I don't have enough money to feed myself and my family, I should not have to be humbled by going to a food bank and have that experience. I want that personal agency to try and get my life on track. And only a basic income makes sense or something like that.
Dr. Kesselman, do you have anything to respond with that?
I quite agree. That people have to humble themselves to get food and basics of life is not anything that we like. And the panel has recommended a large suite of changes for people on disability. Provincial disability, we are advocating that the benefit level move from about $14,000 for a single person to $20,000, which is the provincial poverty threshold. For people in temporary assistance, and they're not a large number, we are recommending about a $3,600 per year increase. And we're also focused on the so-called working poor in terms of people earning 15, 20, or even 25, 30,000, depending upon their family size. We are recommending a provincial earnings supplement scheme and that a variety of basic services be extended to the working poor, such as extended health services, that dental care, basic dental care be extended to the working poor. Some of these things are now available only if you are on income assistance. So there's this so-called welfare wall. And we'd like to treat equitably and better everyone, whether you're on income assistance or whether you're among the working poor. We've worked out a number of specific proposals. We've tried to roughly cost them, and we think it adds up, put it that way.
Okay, well, actually, that brings up a good point. Some folks, I wouldn't say opponents, but some with concerns about a basic income program would say, well, don't we already have programs that help those who are below a certain threshold, who might need some assistance? For example, in Ontario, which is where I reside, where, Roderick, you mentioned that the pilot project for basic income existed under Kathleen Wynne, the previous Liberal Premier, and was scrapped by the current Premier, Doug Ford. Some would say, well, for example, we have OW, Ontario Works. Would that not fill the need? Why have a new program when this one might do just the job? What would you say to that, Roderick?
Ontario Works doesn't come close to meeting the needs of people. I'm sure it's the same in British Columbia. We're interviewing for our Lindsay Advocate magazine right now someone who has $80 left, a single father of two, once his bills are paid. That's a sham of a social program. It does not address the needs that a basic income would. So unfortunately, no, we don't have any program that works. It's nice what Dr. Kesselman said, that they are advocating for a basic income for some people who certainly need it, like those on disability. The same here in Ontario. They don't earn enough to meet their needs.
So with a program like Ontario Disability Support Program, that is not enough money, or that is not meeting the needs of those who have a need, Roderick, in the 25 seconds?
Right, that's correct. Health is one of the main factors. When we look at the social determinants of health, income is right at the top. And since we can very well control who we're born to, and we can only treat people like human beings and make sure that they have enough money that they need. Poverty is an $84 billion a year industry.
Welcome back. We're wrapping up our discussion on basic income, and we're joined by Dr. Kesselman, who authored a report for the BC government, and Roderick Benz, author of a book on basic income. Thank you both again for joining me today. In our discussion, just before we went for commercial, I was asking, would not existing programs do the trick? And very clearly, Roderick, based on your response, you said no, they just simply are not adequate. Maybe I'll ask this to Dr. Kesselman. So could we not then, and I think you did make some suggestion of this, I guess I'm concerned about bureaucratization of a process. If we have a system or a program already in place that meets those individuals, but we simply need more money for those individuals, why not just amplify the existing system? Why create a whole new one? Dr. Kesselman?
I think advocates of a very general basic income would take your first point: too much administration, too much complexity. The question is, can we build an adequate system either on the current structure with major changes, or can we afford it for the general population? And very likely no answer to the second one. And there are also issues of the so-called welfare wall. In our analysis, we find that essentially you kind of recreate that when you try to finance it. There are problems. And making the payments in a timely, responsive way to people's income variations, you can't do that with the Canada Revenue Agency now. I mean, we have the Canada Child Benefit.
Right.
If family's income declines early in 1 year, it's going to be another 12, 15 months or longer because they file their tax return the following by April,
right,
before the benefit can respond. So, messy system. We've tried to do the best, and what we're recommending is going to cost $3.3 to $5 billion, which is a lot of funds to get the politicians to act on, even though it's much less than a basic income would be, a general basic income.
Yeah, I was going to say that's about $12 billion less than what you projected would be the cost for a basic income. Roderick, do you have any comment on that?
First of all, no one credible is suggesting that a single province foot the bill for a basic income. So I think the feds absolutely need to be involved in this. To an earlier point that Dr. Kesselman made, I think we do have the money for a robust social services system in this country, along with the basic income. We can roll some existing income security programs into one. We can draw from income and consumption taxes. We could undertake comprehensive tax reform, which hasn't been done in this country in decades. Create a sovereign wealth tax like Norway has done. The money is there. We just need to recognize that this is a problem that is not going away, and we really need to put as much attention to poverty, give as much attention to poverty as we did with, say, coming up with the vaccine in 1 year.
Okay, so another thing that came to my mind when we think, I know, for example, when we have a employment insurance program, some might argue that, well, you know, that money is good enough, if you will, and that by receiving those benefits, some might argue that some might be disincentivized for say, getting a job. I've heard this argument before. Could we suggest that for basic income, that if there is a basic income afforded to every Canadian, I'm going to ask this question to you, Roderick, would motivation be reduced for those to go out and, say, make more income so that they wouldn't get out of that threshold of making basic income and not just stay in that cohort, if you will?
I don't think we can't deny economic security for the many because of the actions or judgmental attitudes about the few. There are people right now who are abusing EI or disability. Right. We knew this would happen for creative programs, but it's a small number. And I find it interesting that we're always worried about what the poor will do with their money, and we don't think about the wealthy. There are people right now, wealthy people, who are not contributing to society. It's in many cases inherited wealth, so it's not even earned. I'm more interested in what's happening with them and with corporations than I am with a small percentage of poorer people and what they'll do.
Okay, well, thank you so very much for joining us, both of you. I think we had a very good discussion here on basic income, and who knows, we'll see if this might roll out sometime in the future. Thank you very much.
Thank you.
Thank you.
Basic income for me is a fascinating topic. We always must balance, obviously, the fiscal priorities of the country, but also with a social conscience in mind. Will the Trudeau government move forward with this? I guess we'll have to wait and see. For Counterpoint, I'm Tanya Granick-Allen.